My name is Professor Ndubeze Okonkwo. I am an internal medicine specialist. I am a subspecialist in nephrology, consulting in solid organ transplantation, such as kidney and pancreas, period. I am presenting another community service. This one is going to be on diabetes. Diabetes is a very serious disease and one of the most common silent killers. Therefore, it is very important that people are aware of how it affects your body without you knowing it, and how it will gradually kill the patient. What is diabetes? Diabetes is if you have excess blood sugar in your blood, defined by a certain range that the medical community had decided that once you have blood sugar greater than this range, that you do have diabetes. There are many other ways to determine if you have diabetes or not, but this is the most common one. There are different types of diabetes. It's not one size fits all. There is diabetes type 1, then there is type 2 diabetes, there is pregnancy-induced diabetes, another is diabetes insipidus, and then we have autoimmune diabetes. And finally, we have pre-diabetes. One may say that autoimmune diabetes and diabetes type 1 are the same. They are not the same. There are two different categories, but if you decide to group them together, the likelihood is that the treatment may turn out to be different. What causes diabetes? One is genetics. Some people carry the gene, and so when the gene manifests itself by expressing it in the body, the individual develops diabetes. Then diabetes can be caused by infection, mostly viral infection, which destroys the pancreas, which is the organ that produces insulin that controls the level of sugar in our blood. So when your body is not able to produce insulin from your pancreas, then you have diabetes type 1. And it's usually in children and young adults. The likelihood of developing diabetes type 1 after age 30, 40 is extremely remote. At that time, we can pretty much be looking at autoimmune disease destroying the pancreas, making the pancreas unable to produce insulin. Therefore, the person diabetes will act like type 1 diabetes. Another cause is obesity. When your weight is too much, you run the risk of developing diabetes. One of the reasons is the insulin that your body makes has some resistance coming from the body mass. You know, if your size is big, your body is resisting the function of that insulin. So you make insulin, but your body doesn't respond to it, so you end up having diabetes. Another is the food we eat. If we consume things that have fine sugar in large amount on daily basis, one way or the other, without being specific, you end up developing diabetes, or at least pre-diabetes. Another is medication. Certain medicines we take for other medical problems, for instance, steroid. If you are steroid dependent because you need steroid to treat other illnesses, over time, the steroid causes a lot of complications, one of which is diabetes. And finally, there are tumors, cancers that produce things that lead the body to develop diabetes. And as I mentioned earlier, certain autoimmune diseases, meaning when your body is attacked by itself, something happens in your body and your body does not recognize itself, and then you begin to attack yourself. So if you attack certain organs, like if you attack the pancreas, you destroy the pancreas and the pancreas' ability to produce insulin, and the person develops diabetes. These things are not black and white, saying, if it's 100% this, because there are other factors that come together, but this is just a summary. How do we diagnose diabetes? There are many ways to diagnose diabetes, but the most commonly accepted standard is what we call fasting blood sugar level. If you don't eat for a certain number of hours, we check your blood sugar. If it's more than the accepted number for normal blood sugar, then we say you have diabetes, and we can confirm that by repeating the test 2 or 3 times. Another way to check that is we can do a test called hemoglobin A1C, which gives you an idea of maybe over 3 months how the person's sugar had been running. In most cases, that's good enough to establish that one has diabetes. But in some patients who have anemia, particularly of African descent, like people with high turnover of red blood cells destruction and production, such as sickle cell anemia, hemoglobin A1C is going to give you a false reading. So we have to use a fructosamide test in this population in order to determine whether they have diabetes or not. How do we treat diabetes? There are 2 categories of treatment. One is diet and the other is medicine. For someone who has type 2 diabetes, if you aggressively put yourself on balanced diet, devoid of fine refined sugars, and if you need starch, you use a complex carbohydrate as starch, you are more likely to have your diabetes type 2 resolve, if it's not very severe, by losing weight. Then the other is divided into injections, which is insulin, and then the pills. The insulin is made by pancreas, and pancreas is in the upper part on the left in your abdominal cavity. It produces a whole range of hormones, one of which is insulin. The insulin is what regulates your blood sugar. If when you eat food, you break down your food, it gets absorbed into your bloodstream. So if the sugar is high, it is the insulin that is going to take the sugar out of the blood and put it inside the cells. So if you don't have enough insulin, then the sugar is left in your bloodstream, circulating around the clock. And obviously, when you have persistent high level of sugar, then you have diabetes. So when your body is no longer able to make insulin, regardless of what caused your pancreas not to produce the insulin, then you have to get the insulin from outside, produced by the pharmaceutical companies. And there are different kinds of insulin. I won't bug you with them. I will simply say that there are some insulin that are short-acting. if you inject yourself with them, they do their work, within 30 minutes to a few hours. There is intermediate one that takes about 2 to 4 hours for it to do its work, and then there's long-acting one that go all the way to 18 to hours, 12 hours, and etc., up to 24 hours. So that's insulin. There are different kinds. The person who has type 1 diabetes is unable to make insulin at all. Therefore, he has to get insulin from outside. And when you do not use the insulin, what happens is that you're going to die. Why? Because when you have your blood sugar sitting in your blood and not being removed to be placed inside the cells, is going to cause you to be dehydrated. Number two is that you're not going to be able to produce energy from sugar source, and your body is going to revert to what we call anaerobic metabolism, and then fat, using fat in what we call beta oxidation to produce energy. And in so doing, they will generate what we call keto acids, and so the person is going to develop an illness called diabetic ketoacidosis. It's a killer, and if you have it and you don't treat it quickly, you will die. Therefore, if you have type 1 diabetes, you must be on insulin, and it's not whether you want to or not. You have to use it, otherwise you will die. Apart from that, the people who have type 2 diabetes, the mainstay of treatment is diet and then pills. And there are different kinds of pills, different classes. I won't bug you with them, but the goal is to either reduce the amount of sugar that your body has, or to have your pancreas release more insulin, or force your body to respond to the insulin when the pancreas produces it. So we have them in different categories, but the mainstay of treatment for somebody with type 2 diabetes is metformin, and it belongs to a group of medications we call biguanides. And that metformin, what it does is that the liver produces sugar and put it into your blood. So metformin will stop the hepatic glucose production. It will decrease it tremendously, and that's the mechanism by which it treats diabetes, by minimizing the available sugar in your blood. There's another group called the sulfonylurea, one of which is glipizide. Again, I won't bother you with all classes of these medicines and their mechanisms of actions. So this one basically is going to force the pancreas to release more insulin. And then there are those that will force the body to respond to the insulin when it's produced by the pancreas. So this is how you use the pills to treat diabetes. Recently, it's been established that some patients who have heart disease at the same time have diabetes. In addition to other medicines you are giving the person for diabetes, it is very life-saving and useful for you to introduce another kind of pill, though it's very expensive. Okay, that pill, we give it a name, sodium glucose cotransporter 2 inhibitor. It's a long grammar, but you don't need to remember that because that's the job of your physician. At the same time, for people who have diabetes insipidus, remember that I said that this particular diabetes is either caused by the brain problem or is caused by a kidney problem. So in this case, you have to address the problem with the kidney or address the problem with the brain, and then the diabetes goes away. For instance, the kidney has the job of regulating or controlling the water in your body, the sugar in your body in a sense, electrolytes, which are salts in your body. So when the kidney malfunctions, there are areas of the kidney we call receptors. So if the area that receives information from the brain to say, let sugar go out of the body into the urine, or reabsorb sugar, reabsorb water, or reabsorb salts, if any of those receptors are damaged, can have the tendency of having what we call nephrogenic diabetes insipidus. So your brain is making the hormones you need, such as vasopressin, and when it sends the stimulus to the kidney, and then the kidney is not going to respond. Therefore, you don't have the ability to keep your water, and so you keep pouring out water into your bladder. And then when you remove a lot of water from the body, then you're going to have very high concentration of solutes or solid materials that are in your blood, one of which is glucose, and then you're going to have high blood sugar, and that's diabetes. So we call it diabetic insipidus. So in this case, if your brain, since the kidney is not responding to that, there is a medication we can give you that is going to tell the kidney, hey, you're going to respond, and the kidney responds. And then in some cases, it's the brain that is not producing the chemical, the vasopressin. Therefore, we have to get the vasopressin from outside and inject it to the patient the same way we inject insulin, and that is taken care of. The other modality of treatment is surgery. If somebody has a tumor or cancer that is producing substances that impair the ability of the body to produce insulin, or forces some organs like adrenal gland to produce a lot of steroid called cortisol, which in turn is going to make the body, through some mechanisms, to develop diabetes. So if you take care of the adrenal gland, surgically speaking, dealing with the tumor, then that problem resolves. So as you can see, that the treatment of diabetes is not just one pill fit all. There are many modalities depending on the type of diabetes the individual has. But what is very important to remember, even if you don't remember any of the things I have just said, remember the complications that come from diabetes, because these are the killers, and they kill silently. So I'm going to take them in a summary, step by step. Just having a mind stand in front of you, and you start from the head and you go to the toe. So the first organ to take a look at is the brain. So one of the things that kill people through the brain, very common one, is stroke. And stroke is called brain attack. Just like we have heart attack, we have brain attack. That's called stroke. And stroke is basically when the blood vessel that carry blood to supply your brain tissue, if it's either blocked or it ruptures, then you have inability to supply blood to that portion of the brain, and that portion of the brain dies. And unfortunately, because the brain controls everything your body does, your ability to see, smell, hear, eat, swallow, move your arms, run, sleep, everything is controlled by the brain. So any part of the brain that is damaged, that portion of the body that the brain controls, is no longer going to function. That's why if somebody has a stroke, sometimes you see they're unable to swallow, so they have to have feeding tube, because the part of the brain that controls swallowing is damaged. Some people can have stroke and go blind because the portion of the brain that controls vision is dead. Sense of smell, the same. You see people have stroke. If you look, sometimes they're hemiplegic. A part of their body, half of it is no longer working because the portion of the brain that controls that side of the body is damaged, either because the blood vessel coming to supply that portion of the brain is either damaged by blockade or it ruptured. And as a result, which I'm going to deal with on a different day, different topic on stroke, because if you have hemorrhagic stroke, it means the blood vessel has ruptured and therefore there is no irrigation, no blood supply or perfusion of that particular side of the brain, or something is blocking the blood flow. Okay, it can be thrombosis, something you form a clot there, or blocking the passage of blood, or you can have an embolic event in which the heart can cause somebody to have stroke, because you can form blood clot in the heart if you have atrial fibrillation, which is irregular heartbeat, and it's going to bring that clot through blood circulation to the brain, and then you have a stroke. So that's a different topic. But How is this related to diabetes? Diabetes is what causes the damage, one of the things that cause the damage to the blood vessels in the brain. We call atherosclerosis, when the blood vessel is so stiff that it loses its ability to expand and contract as needed, because if too much blood is coming, the blood vessel needs to expand to minimize the pressure. But if the blood vessel does not expand and a lot of blood is coming with pressure, it's going to burst open. Diabetes, along with smoking and hypertension, are the main culprits. So if you have diabetes and it's not well treated, you run the risk of having stroke as one of its major complications. The second is the eye. Number one cause of blindness in America, in most parts of the world, is diabetes. And how does it happen? When the blood sugar continues to remain high, just like you have your camera and you have a film in your camera when you want to take a picture. When you take a picture, light will go from the object you want to photograph and travel through the aperture of your camera and go to the back to hit the film and then record the image on that film. You take the film to the dark room and produce it. That's how we have the photograph of somebody you want to see his photograph that you have just taken. The same thing applies to the eyes. The way you can see a moving car or see a person is that light from that person will go through the apertures in your eyes. You have both lens and the pupil. These are parts of the eye, but there's a hole in your eye that the same way like you have in the camera. Light will come and go through it and go to the back. At the back of your eye, you have a film there. That film is called retina. And that retina has quite a bit of blood vessels. So when you have diabetes, it will go and destroy those blood vessels gradually. And as it's destroying the blood vessels, it's going to begin to leak things out of the blood vessel into the eye tissue. Or the blood vessels will multiply, in other words, increase in number, new blood vessels. We call this neovascularization. So when you have new blood vessels come upon the film, then it's like you are using your hand to cover the film. And when you take a picture, you're not going to see anything because there is no film for it to register on. So when you have diabetes, you are supposed to be seeing your doctors, a minimum, eye doctor minimum, once a year, so they can take a look at your eyes and make sure you're not developing new blood vessels. And if you are, they are going to use a technique using laser to remove these blood vessels on a yearly basis and as frequent as they want to do so, depending on your need, in order to stop you from being blind. So if you have diabetes and you're not seeing an eye doctor, you're not doing yourself a good service because you're going to be blind. Okay? So we go from the eye down to the heart. If you have diabetes and it's not well controlled, you're going to be sclerosing the blood vessel, again, blocking the blood vessel that is supplying blood to the heart muscles. And sooner or later, you're going to have a heart attack. Okay, the next one is your intestine. For when you eat, the food is going to go from your mouth into the food pipe, then down to the stomach, and from stomach, it's going to go to the small intestine. After the food is digested, it gets into the small intestine for it to be absorbed or transported from small intestine into the blood. And whatever the waste is going to go to the large intestine, and then from there, it's going to go outside, called the bathroom. For this to happen, the intestine has to be contracting to push down the food and push down the stool for it to go outside. This contraction will come as a result of nerves stimulating the gut and telling the gut, I need you to contract. I need you not to contract. And then the blood vessels, they are very tiny, that come there to supply the gut also. Diabetes will destroy both of them. And when it does, the patient ends up with constipation all the time or vomiting all the time. If you vomit all the time, you can't eat, you can't hold food down, the person probably has developed what you call gastroparesis, meaning the gut just sits there, not responding to any stimulus from the nerves, because diabetes has damaged that. Okay, from there you go from the gut and you go to the kidneys. Number one cause of kidney failure is diabetes. And so it is better for you not to have diabetes, but if you do, the best thing we can do is to do your best to make sure it's controlled all the time by following the recommendations your physician has given you and taking the medicines or the insulin as needed. From the kidneys, then we go to the legs, along with the blood vessels. So the blood vessels that carry your blood to all parts of your body, all of them are affected by diabetes. And they continue to narrow the blood vessels over time. And so instead of being wide enough for blood to go through to get to all parts of you, the blood will be sluggish, you won't be getting there, and then sooner or later, you're going to start having problems. So when it comes to the leg, your leg doesn't get enough blood, you're going to develop gangrene. Your toes will become black over time, and if it becomes black, it means it's dead. So they have to cut the toes off. They cut the toes off, you get infected because there's always sugar there. The bacteria like to eat sugar. Then they'll cut your foot, and then the same complication continues. Then they're going to cut the leg, and that's amputation. Number one cause of losing your leg is diabetes. Another thing it does to the leg is by damaging the nerves that supply all the body parts, particularly the legs, and it's called neuropathy. You're going to be having very painful leg. At the end of the day, it does not give the person ability to even recognize. When you step onto a nail, you won't know that you have a nail inside of your foot because the sensation has been destroyed by diabetes. So when something pricks your foot, you won't know. If you want to go into the bathtub to shower, you don't want to turn on the hot water and use your leg to find out if it's hot or not, because you're not going to be able to sense it after some time because the nerves, the receptors on your legs, your feet, they're all destroyed. So you have to have somebody to come and check the temperature of the water for you before you get in there, and etc. And so one of the reasons people lose their legs a lot in Nigeria, and we call that voodoo or enyule, is because you don't have sensation in your feet anymore. You walk bare feet in your house, the fish bone that you dropped on the floor sticks you, carries bacteria into your foot. You don't know that it happened, and then your foot starts getting infected. Over time, you develop abscess and then disseminated the infection. Then either you die from it or they cut the leg. So you can see the diabetes affects every part of your body. Therefore, the best thing to do is to prevent yourself from developing diabetes. And if you do develop it, is to follow the treatment regimen as recommended by your doctor. And then in prevention, what can I do to prevent diabetes? Again, there are different types of diabetes. Type 1, you have no control over type 1 because if you have a viral infection, you can't tell virus not to enter your body. But it happens mostly to children, people below the age of 30. But those ones you can prevent, such as the food you eat. So by dieting, you can prevent type 2 diabetes. If you can't prevent it because it's genetic, at least you modify the risk. And then the other is exercise. Exercise is tremendously very helpful to the body. It's the best medicine that's ever useful to the body. But because your body doesn't charge you money when you exercise, we don't think it's important to exercise. And then to prevent the other ones, there are certain tumors you can prevent by the things you eat and do. And when the tumors are in early age, if discovered early, is taken out, and then that contribution to diabetes is not there. Autoimmune diseases that cause diabetes. Some, we have an idea of their association, but we are not 100% sure that if you do this 1, 2, 3, then you won't develop them. Medications, if we know that this medicine causes diabetes, we have to be very careful not to use them unless they're absolutely necessary. So if you're using steroid because you have arthritis, some people, instead of having steroid injected into their knee, their doctors will give a steroid to take by mouth over a period of time. They develop diabetes. And of course, there are many other complications of steroids. That's going to be a topic of a different day. So in summary, diabetes is a silent killer. Do the best you can to prevent developing diabetes. If you develop it, please take the medicine and see your doctors as frequent as possible. And exercise, diet, get good sleep, drink a lot of water, and prevent the complications the best way possible. Because when they come, some of them are not very comfortable, because being on dialysis 4 hours, 3 times a week, and not eat what you want, can't drink what you want, can't go where you want to go unless you have arranged who is going to dialyze you when you get there, and etc. So anything you can do to prevent kidney failure, please do so. And I hope this is helpful.